I'm Dr. Robert Schachter. I teach at the Mount Sinai School of Medicine in New York. I work with insomnia and other sleep problems. Sleep disorders are serious. They affect one's ability to function. If you don't get enough sleep, you can't function properly. Lack of sleep affects many aspects of one's life. Snoring can interrupt sleep, and when one's sleep is disturbed, there are many effects. They become tired the next day. They can't concentrate. It affects the quality of their work. They become more irritable. They have mood swings. Life becomes more difficult. One of the greatest problems with snoring is the effect on the partner of the person who's snoring. Sometimes the snorer does not wake up, but the partner always does. So the partner is the one with the most disrupted sleep and the one who suffers the consequences the most. It's important to do something about snoring. Snoring is a serious problem, and it can be caused for a range of reasons. One is the softening of the muscle tone in the palate, throat, and pharynx that results in a vibration of the tongue against the palate. Often we breathe through our nose. However, if we are congested, or if there's an inflammation of the nasal passageway, we can't, and therefore breathe through the mouth. The breathing through the mouth causes a vibration of the tongue against the palate, and that's what causes snoring. Y-Snore is a product that treats that very, very effectively. It's an anti-inflammatory and is targeted to reduce the congestion that occurs in nasal passageways, and it works for long periods of time. Snoring can occur as people age or if they gain weight. The percentage of people who snore increases as they get older. If one gains weight, often that will affect the physiology of the throat. A flap of skin will close the air passageway, and they're more prone to congestion and to difficulty breathing. The first step to treating snoring is to get an over-the-counter remedy. The best one that I know of is Y-Snore. Y-Snore works, and it's extremely safe. It's made from an herbal base and is homeopathic, and therefore has absolutely no side effects. It can also be used continuously with extreme effectiveness for long periods of time. Sleep disorders were not known until the late 1950s. It was at that time that a sleep disorder center at Stanford University was founded. This is the same sleep disorder center that did a study for Y-Snore, in which it was found to be extremely effective, with 66% of the participants who had congestive snoring. Apnea is a serious disorder and needs to be assessed at a sleep disorder center. What happens with apnea is the person actually stops breathing for fractions of a second. When the body has a lack of oxygen, it wakes up, and this disrupts the sleep. Apnea is characterized by very loud snoring and sometimes waking, gasping for breath. If one has the symptoms of this, they do need to get it assessed professionally at a sleep disorder center. I'm Dr. Robert Schachter. I hope this answered some of your questions about snoring and how Y-Snore can be effective in helping that problem.